Two. Hey everyone, and Evan and Jeremy here with Avira Health, and we are super excited for this chat today with Hyland Software, a true innovator in the health IT space, in particular with HIMSS happening around us. Alex, how are you?
I'm very well, and thank you for giving me this opportunity to speak with you. Very exciting.
Thanks for being here. We're huge fans of your work. Before we dive in, maybe introduce yourself, your bio a little bit, and for those who aren't aware, who is Hyland?
Sure. My name's Alexander Ryan. I am a director at Highland, Highland Healthcare, and been in the healthcare IT industry for over 20 years now, specializing in internationalization and go-to-market. So the areas I'm particularly focusing on now are EMEA, Europe, and the Middle East. So in terms of Highland, we're, as you said, an innovative company focusing on managing unstructured content across the enterprise. So in this particular session, it's about the imaging outside of radiology and how we bring that together and make it in a meaningful way and present it in an efficient and structured format to the clinician.
Such an important topic, particularly in light of the workforce management challenges that health systems are facing really around the world, not just in
Mhm.
EMEA. Maybe talk about how your solutions at Highland are helping address those challenges, and
Mhm.
tell us about the good work you're doing there.
Absolutely, I appreciate that. So, um, like any organization, we got hit heavily with the pandemic, like everybody globally. Not to mention a lot of the public health systems in Europe, and they suffered a particular. They're now suffering from clinical burnout, or what they call clinician burnout, and a lot of the organizations, not just in EMEA but also in the US, are looking to technology to readdress the work-life balance, um, to stem the flow of these clinicians leaving the profession. Right? So as we have aging populations, as the clinicians are required to do more work, technology needs to step in and be able to take some of that load and also address efficiency, but also allow them to have work-life balance. So some examples include, I mean, if we look at our nil read software, the use of intelligent hanging protocols, right, allowing so one of our particular customers, NY Langone Ophthalmology, the clinicians are utilizing nil read for streamlined workflows. So this is leading to 33% increase in their patient consultations. Right, so they're allowing to increase the throughput of patients by 33% and reducing waiting times within that element. I mean, if we stay on nil read is also allowing the solution to. It's a zero footprint viewer. So what it will do is it will allow access across multiple repositories, irrespective of vendor, hence the interoperability elements. And because it's a zero footprint viewer, it's allowing clinicians to be able to also report from home and have access to their images, which may be at the hospital or within the cloud, and to be able to report some of their images from home. That again allows them to be more efficient, but also addresses this work-life balance. And this is something which has become increasingly poignant post the pandemic. What we're also seeing is the elimination of re-imaging due to the lack of image access, because as organizations are consolidating into RVNAs, what is then allowing them to happen is access all of the imaging that's required across the healthcare organization. And it, one, limits the amount of imaging required by the patient, hence increasing patient safety and not exposing the patient to more radiation. But also it's not taking up an additional scan or review time that would normally be the case in because they have access to the image or previous history, clinical history. Whereas before, when it was in silos of information, they wouldn't be able to find that, or it would take them a long time to find that information. I mean, one example is Kaiser Permanente. So they've consolidated the imaging repositories into RVNA, and that's resulted in a cost saving of $3.2 million over 3 years, just by not having the access to the images, but then also not having to do a lot of the re-imaging as well. Other examples I would say is based around our PACS care solutions, where organizations have been able to increase their efficiency by not having to burn CDs, right? So what they've been able to do is, one of our organizations has been able to reduce their costs by about $300,000 annually, and repurpose their staff into what I would say more meaningful tasks, right? So directly, it's increased the efficiency. It's allowed the imaging to flow throughout the organization, but it's also increased work satisfaction, because these individuals have been able to be repurposed to what the organization would deem more meaningful tasks.
Well, so this is quite a expose of what Hyland solutions have been able to provide. So improved patient experience, increased throughput, while also improving work-life balance for physicians and other healthcare providers. This is quite impressive, and the cost savings. So
Absolutely.
maybe tell us a little bit more about what other healthcare systems can learn from experience of these people who've implemented your solutions, and additional benefits that could be obtained from this, and maybe talk a little bit about interoperability. I was very interested in this elimination of having to bring CDs from doctor to doctor, etc. So give us a little bit more of a picture.
Absolutely. So especially in an international scenario where the investments are public, it's the public purse. So we're not asking customers to rip and replace, as they would say. What we would say is that by being interoperable and following those standards, we're able to integrate with the systems that are already there, right? So that is something that's obviously is saving money. It's allowing them to realize these benefits, as we've stated. And what we're now starting to see is it's not so much us teaching the organizations on how to do this. It's very much a partnership, right? So if we take an example of the Dutch customers that we have, we recently had a Dutch user group meeting where it was a mutual exchange of ideas, where we showed them obviously the technology and how it could help, and where we had customers showing also potential customers that were considering going down the digitization path. But it's also them explaining to us how the Dutch IHE profiles are relevant, and how feeding that back to our product management to be able to make sure that the solutions not only just offer maximum benefit for them, but it also offers maximum benefit in a national context, right? Because a lot of these health systems are moving into regional, if not national, sharing. They have regional and national sharing requirements. I mean, another example is in Helsinki, one of our customers, Helsinki University Hospital. They're using RVNA and our viewer, and it's integrated towards the National Archive, where they're able to centrally store all of the information about the patient. So it's not only just being shared across 20 plus hospitals in secondary care, it's moving into primary care, and they're able to access the images now also in social care across the organization. All of it from a central repository within our technology. But again, this wasn't us coming in and telling them how to do it. This was very much a collaboration. And I see that as one of the benefits, one of the true benefits of Hyland, in being able to work with our customers and being able to adapt our solutions to suit the market requirements, especially in a a multicultural market such as Europe.
Absolutely. Well said. I was really intrigued by this idea of managing islands of data through enterprise-wide imaging. Enterprises, healthcare systems of all sizes have this, silo problem when it
Mhm.
comes to data. What's been their feedback as far as enhancing patient outcomes and streamlining delivery? They must be measuring these sorts of things.
Yes, they are. So, uh, as some of the examples that I already gave you around Kaiser Permanente being able to save that amount of money, the throughput that MYO Langone have been able to do, increasing by 33%, and also having access to the images. We've had other organizations like Kaiser Permanente, but also European organizations that have been able to save between $600,000 to $700,000 a year just being able to implement the solution and have access to the images through their electronic patient record through an integration with that solution. So again, it is something that is pretty poignant, and they don't have to reorder imaging studies because they don't have the visibility, because now that visibility is given to them, not only just by the viewer, but also by implementing a central VNA. What we're seeing is that they're able to send copies of these images from these silos into a central VNA that's able to streamline and store the data. So the feedback has been incredibly positive around the solutions, and again through that mutual cooperation with those key customers and giving that feedback and taking it on board, we're hoping to take it to the next level in being able to support them and ultimately improve efficiency and this work-life balance, because this, especially uh, from my experience, needs to be addressed, because losing clinical staff because of burnout is it's unacceptable. And if there's something that we can do from a technology perspective, I think we have a mandate to help them achieve those goals.
Great, great. I can't help but notice that we're talking about advanced technology, and it's been 12 minutes, and we haven't mentioned AI even once yet. So I wanted to ask you, how do you see AI and machine learning technologies integrating with enterprise imaging, medical imaging, to further support healthcare professionals? Maybe you're already using AI behind the scenes. So just talk a little bit about um, the
Uh,
latest buzzword
ab-
AI.
Absolutely. So AI is 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 we've decided to partner with a company called DeepSea, so a German-based company that have incredible technology. They're also at the event. So what that is allowing us to do is offer that improved efficiency to the organizations. It's, I mean, there is an element of patient safety involved, but it's not going to be there to replace the clinician. It's there as a support tool, and we can't lose sight of that fact, right? Technology is it's there as a support tool, very much like maybe some people would use ChatGPT in their local life to kind of get the points within a document to kind of streamline their life. But I mean, in terms of this is a much more advanced algorithm base, and it's clinical use, and it is something that is that our customers are asking for, and we're excited about where this is going to lead. So AI is part of the, let's call it, the next generation of tools that have been integrated into the Highland portfolio. And that relationship that we mentioned earlier around with DeepSea is one of the pillars of us moving forward and making sure that we satisfy the requirements of the clinical community.
Wow, so exciting. I can't wait to see that partnership unfold. HIMSS is a big event. There are lots of trends and opportunities. What else is on your radar personally, professionally, in enterprise medical imaging? What should health systems be aware of or prepare for short term and long term?
Mm-hmm. They should prepare for their investments and their digitization strategies, right? So if they have the chance to kind of embark on this digitization strategy and enhance those requirements, they should have all of the lessons learned that we've talked about, obviously avoiding these silos, avoiding making sure that you're buying vendors that offer interoperability, buying vendors that will fulfill the requirements of your workforce, right? So the decision is not just an IT-based decision, it's also a clinical-based decision, right? So getting feedback from the clinical body is something that will be paramount going forward, especially if you're looking to avoid, as we discussed from this topic at the beginning, around reducing work-life, reducing the pressures of burnout, but also improving work-life balance. So ultimately, getting the stakeholder on the clinical side even more involved in the decision-making process when making those requirements available. So that is something which you can do in the short, medium, and long term, right? To constantly reevaluate that. And that is something that's you see many healthcare institutions starting to introduce the roles of chief clinical information officers or chief nursing information officers that are there to work alongside IT and make sure that what they are looking to procure fulfills the requirements of what the body they're there to represent is asking for, right? So I'd like to see more of that, and we are seeing more of that. And I'd almost like to see it speed up, and for them to have more power in their say. But I think we're getting there.
That's wonderful. I just love the theme of partnership and collaboration that you've talked about, and also your unique perspective of how healthcare systems in Europe and in the wider world work together and collaborate. And obviously, healthcare systems in the US are different. And having all of that experience, can you perhaps give some advice to healthcare system leaders who are considering implementing or upgrading their enterprise medical imaging solutions, specifically from the perspective of supporting their workforce, which is a challenge around the world?
Stakeholder involvement. Make sure you've got stakeholders from the relevant bodies. I think what you also need to make sure is that you're also buying a technology that has interoperability at its culture, right? So those would be probably the two largest, well, best bit of advice we could give. So from what we are seeing is the health systems that are most successful in deploying the technology are the ones that have buy-in from multiple stakeholders, especially from the clinical body.
Wow, such good advice, very practical advice, and we can't wait to follow all the news and announcements from HIMSS and from Highland this week. And congratulations on the work you're doing, so needed, so important. And good luck, Alex, onwards and upwards.
Thank you very much for your time. Appreciate it.
Yeah, Alex.
Thanks, everyone, for watching.
Right.
Reach out to Highland at HIMSS and explore more about this incredible future they're creating. Thanks so much.